Remembering your username and password can be a challenge. If you have your own PDMP account, your username will be your DEA number. However, if you're using a delegate account, your password will be your first name dot last name. If you need a password reset, please call the vendor, HID, at 1-866-205-1222. If you can't find a patient, try shortening the patient's first name to the first 3 letters. Try leaving the zip code or county fields blank. Does the patient have a different name on his or her insurance card? If so, try entering that name. The software vendor and the PDMP do our best to minimize the number of data errors you encounter when looking up a patient's prescription history. However, some errors are inevitable using an administrative data set. The following errors are the ones that most commonly appear. The PDMP vendor's software uses a matching process that links patient records in a very specific way. But sometimes, slight variations in the data lead to a non-match. Non-matching entries are manually fixed by PDMP staff when possible. For example, confirming the name Dan or Danny is the same as the name Daniel. We aim to make the matching process as accurate as possible while still capturing as many matches as we can. Ultimately, we want to provide quick but accurate prescription review for your patients. When pharmacies upload prescription information, there is potential for a fatal error. Records with fatal errors do not upload into the PDMP. When this happens, PDMP staff have to identify fatal errors and contact the pharmacy to report the error. The pharmacy then has to fix the error and resubmit the data for the record to appear in the system. Data in the system are not real time. It can take 1 to 2 weeks for new prescriptions to show up in a patient report. The pharmacist or pharmacy technician may make data entry errors. The pharmacy can only use the information that's given to them by the patient. There can be issues with names such as Jeffrey, spelled Jeffrey, and Geoffrey, spelled Geoffrey. Certain data errors are not fatal, and the record will upload with incorrect information. The prescriber or date the prescriptions was filled could be incorrect, or the patient's name could be spelled incorrectly. All of these errors would allow the record to upload into the system, yet provide incorrect patient data. While there are opportunities for errors, the error rate is quite low. During a 1-month time period during February of 2015, there were 3,836 errors among the 587,153 records uploaded to the PDMP. That's an error rate of less than 1%. Since there's potential for some errors within the PDMP, you should verify with patients that the reports are accurate before any clinical decisions are made or before actions are taken.